For millions of women, the symptoms are all too familiar. You experience unexplained weight gain, irregular periods, and stubborn acne, only to be told by a doctor that the problem is simply cysts on your ovaries. But there is a coordinated global effort by the medical community to rename polycystic ovary syndrome to PCOS, polyendocrine metabolic ovarian syndrome. The shift is necessary because those so-called cysts are actually antral follicles, normal, fluid-filled sacs that all women have. The real culprit is a system-wide metabolic error affecting the entire body. Realizing you are dealing with a metabolic disorder changes the entire strategy. It moves the focus away from surface symptoms and toward the underlying biochemical engine. This condition affects 1 in 8 women, and the high rate of obesity associated with it, which research shows impacts up to 88% of patients, is a biochemical trap rather than a lack of willpower. The engine runs on insulin resistance. When the body's cells stop responding to insulin, blood sugar rises, forcing the pancreas to pump out even more insulin to compensate. High levels of insulin act as a chemical trigger, forcing the ovaries to overproduce androgens, or male hormones. This hormonal spike is what drives the acne and excess hair growth. Those androgens signal the body to rapidly store visceral fat, the deep internal fat that gathers around the abdomen. Visceral fat is active tissue that releases chronic inflammation into the body. This inflammation then worsens the original insulin resistance, locking the body into a self-reinforcing loop. To stop this condition, patients need specific lifestyle interventions designed to short-circuit this self-feeding biological process. Intervention begins with targeted nutrition to lower insulin production. Research suggests that even a modest 5 to 10% reduction in body weight can decisively disrupt the cycle. This involves replacing refined carbohydrates with low glycemic whole grains. Prioritizing protein and adding healthy fats to meals stabilizes blood sugar, preventing the insulin spikes that feed the engine. Omega-3 polyunsaturated fatty acids are particularly effective here. These healthy fats combat the specific inflammatory markers that keep the loop spinning. This academic meta-analysis details the efficacy of omega-3s. The data shows that supplementation significantly reduces C-reactive protein, a key inflammatory marker, while lowering serum total testosterone in PCOS patients. By removing simple sugars and adding anti-inflammatory fats, the pancreas can return to a normal rhythm, breaking the cycle at its source. Movement offers a second point of intervention. While exercise is vital, a recent comparative study proves that the type of movement you choose changes the outcome for PCOS patients. Researchers tracked obese patients over a 12-week period across 4 regimens: cardio only, strength only, yoga only, and a combined routine. This chart tracks the combined symptoms across each group. While the cardio-only group lost weight early on, the prominent red and green columns show they also suffered a significant spike in fatigue and menstrual irregularities. The failure of the cardio-only plan comes down to stress. Intense, prolonged aerobic exercise without recovery spikes cortisol, a stress hormone that promotes viscera fat and halts ovarian function. This pie chart shows the percentage of participants achieving clinically meaningful weight loss. The combined regimen, which integrated cardio, strength, and yoga, showed the highest success rate with the fewest side effects. A mixed modality routine works because the strength and cardio components build insulin-sensitive muscle, while yoga helps lower the stress hormones that feed the loop. We also have to account for the psychological toll and chronic sleep disruption associated with the syndrome. Anxiety, depression, and poor sleep function as physical biological events. They raise cortisol levels in the bloodstream, providing direct inflammatory fuel for the loop. Prioritizing sleep and stress management starves the cycle of the cortisol it needs to survive. When these strategies are combined, the biological engine is forced to run in reverse, creating a virtuous cycle. Improved insulin sensitivity lowers androgens, which clears the skin and helps regulate menstrual cycles. These physical changes often provide a significant boost to psychological empowerment. Because every woman's biology is unique, personalized strategies from healthcare professionals are essential to fine-tuning these interventions. For some, medication can provide a necessary jumpstart. Recent data indicates that GLP-1 medications resulted in an 11.5% weight loss for patients, compared to just 1.9% from traditional drugs like metformin. These medical tools help initiate the reversal of the metabolic loop when lifestyle changes alone require additional support. This understanding reframes the condition. It takes a confusing reproductive diagnosis and turns it into a manageable metabolic state. The body is reacting logically to a biological loop that can be broken. By understanding the metabolic machinery beneath the surface, women are empowered to restore hormonal harmony and step back into the driver's seat of their health.